According to the World Health Organization, cervical cancer is the second most common cancer affecting women in Nigeria and the fourth most common cancer among women globally. On the average, 28 Nigerian women died from cervical cancer every day in 2018, resulting in a total of more than 10,000 deaths. According to the HPV Centre, about 70% of all known cases of cervical cancer are caused by the human papillomavirus, HPV, and they can be treated by the HPV vaccine.
Now, during the biannual review meeting of the committee, there, of course, were numerous discussions. And, of course, the religious leaders who also came together on primary healthcare delivery in Abuja in August. The executive director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, announced that on the 25th of September, the government will be introducing the HPV vaccine that prevents cervical cancer when given to young girls aged between 9 and 15 years, although that has not been effected. We are joined this morning to discuss this further. Of course, we'll be expecting the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, to join us in a bit. But, before that, we also have Itoro Usoro, who's a young change leader and activist from Nguvu Collective. Good morning, Itoro. Thanks for joining us.
Good morning. Thank you for having me.
All right, Itoro, thank you for joining us this morning from Uyo. Let's start the conversation talking about, you started a petition on change.org in June 2023 asking the government to include the HPV vaccination in the National Immunization Program. Talk to us about why you did this and exactly how much attention this petition got.
Okay, thank you so much. My name is Itoro Osoro, and I started a petition in June, to be precise, to federal government to include HPV vaccine in our national immunization program. But prior to this time, back in 2017, I lost my mom to this particular menace, which of course is what prompted me to start on the mission of reaching out to women. In 2017, I was called that my mom was taken to the hospital, and I happened to be with her for 3 months. So I was face to face, with the issue of cervical cancer. I saw the pains. I saw, how she felt. Most times she's on the ground, the pains was quite unbearable. So this really touched me. And of course, when we lost her, I felt really pain, and I decided to do something different. I went into investigation, and I discovered that cervical cancer is actually preventable if there is what we call early detection. But then here is my mom, who was diagnosed barely 6 months, and she was gone. So I decided to start this project. Unfortunately for me, in May 2023, I joined the Nguvu Collective, who taught me, trained me, and of course, showed me how to go about this. And I started this petition on the Change.org platform, which has actually gained a whole lot of traction. We have thousands of Nigerians who have also shared my experience, and they've signed, and I'm happy that the federal government has decided to roll out a vaccine, which of course will prevent this menace.
First of all, thank you so much for sharing your story with us, and we want to express our condolences to you and your family for losing your mom. Such a short time, 6 months from diagnosis to her passing. It's a very unfortunate death, and we thank you for keeping her legacy by doing the work that you're doing. And now, how much popularity would you say that conversations about cervical cancer have received in Nigeria? And what are you looking to see? What impact are you looking to see us have in Nigeria as regards awareness about this?
Okay, talking about awareness is very low from experience. I've been on this for 2 years. I've reached out to low and middle income areas of the nation, and it will surprise you to know that even last month I was in Abuja. We had a session where I was able to reach out to about 230 women, and out of 230 women that I met, only 10 of them heard about this before that time, and none of them have been screened. So talking about awareness is very low. There are so many women who they've never heard about cervical cancer, talk less of going for the screening. And this is actually, a disease that does not show symptom, not until it has gotten to the advanced stage. Okay, so the awareness is pretty low, and I like to encourage federal government to do more, even as civil organizations like we are pushing to see how we can reach out to women. So talking about the awareness is low, is low.
I mean, we are also going to be speaking this morning with the Executive Director of the National Primary Healthcare Development Agency, Faisal Shuaib. There's meant to be a campaign, a rollout from the 25th of September that doesn't seem to have kicked off or didn't seem to, go as planned. Um, we've been speaking about human papillomavirus for years. I remember that I've had these conversations as far back as 8 years ago. Would you say that the Nigerian government is honestly doing enough? As much as there's these campaigns every now and then on media platforms, but are they honestly doing enough? Is there sincerity in the fight against, human papillomavirus and cervical cancer?
Okay, statistics will actually answer that because if you go to developed nations, you see that they've been able to manage and tackle this particular menace, and they've reduced it to barest minimum. But talking about our nation, if we've done enough, if the government have done enough, then we wouldn't be talking about people not even hearing about it. I mean, I've met graduates, I've met people, some master degree holder who have never heard about it. Talking about my personal story now, I didn't know about this not until that happened to my mom. So I feel we still have a lot to do from awareness, and from my experience visiting medical facilities in those low and middle income areas, some of them do not even have the facilities to actually handle this. Okay, so the government can do better. I know they are trying, but then they should be able to do better in this regard because you are losing a whole lot of women to this particular issue.
I mean, it's very important that the government does so much. Cervical cancer is the only cancer that has pre-cancer cells, meaning that it can be detected early enough and prevented. Yeah. And the number of women who have never in their lives had a pap smear, who don't understand the amount of how important it is. Now, let's also talk about access and affordability. I know that you spent some time with your mom. You've been doing a lot of work on this as well. How accessible and how affordable is a pap smear? And how can the government step in maybe to, because people have to eat first. Some people are struggling to have a 3 square meal, and then you're telling them about a pap smear. They can't even afford to eat, and how do they get the money? So how affordable is it currently, and what can the government do to maybe cushion the effect that the cost might have?
Okay, talking about accessibility and affordability, truth be told, uh, these are really, accessible and is quite high. For us at Help the Woman campaign, because I started a campaign in that regard, last month we were supposed to have, there's what we call free cervical cancer. We do it free for women in the locations we visit. We collaborate with medical facilities and professionals in that area, and we invite women, they come and they are screened for free. For last month, we were unable to actually carry that out because we had a budget prior to the last month event, and by the time I went back for us to finalize that, the price had tripled. While I was in Abuja, I met a facility, and the price to screen a woman is almost 30,000 naira. So that's pretty high. That's high. That's high. And so many women cannot afford that. Even for us as an organization, we couldn't carry on what we had for last month because the price was quite overshooting our budget. So we just had to, manage and see how we can raise more funds to actually make that happen. So talking about affordability, it is not affordable, and accessibility is really accessible, especially in those areas that really need these screening services.
All right. Can you talk a little bit more about vaccination? I know that there's targets that have been set for 2030, 2050, and the likes. But where are we with vaccination? Is that a project that is being worked on? And do you think that we will be able to set target for ourselves here in Nigeria also?
Okay, talking about vaccination, this particular menace is preventable. With the vaccines, we're able to cope this issue. in Nigeria, we do not have vaccines. That's why personally I decided to, write that petition to federal government, because this should actually be part of our national immunization program. By the time that happens, catch them young. When you catch them young, we are not even talking about this issue that is causing a whole lot of issues to so many families across the nation. So vaccination is really, accessible, and very few persons know about it. Like if you ask 100 women about this, less than 10 will know about it. So government should make this available. Then awareness, there should be a whole lot, to be done on awareness, because people are really ignorant about this.
All right. Thank you so much, Itoro, for joining us this morning. And once again, thank you for keeping your mother's legacy alive with the work that you do. Lots of Nigerian women and African women need this information out there. So we thank you very much for joining us this morning.
Thank you.
All right. That was quite an interesting conversation that we had there. And, some of the important things to note when it comes to conversation about cervical cancer would be the fact that as a woman out there, if you're a woman who has been sexually active, it's important, regardless of how many times or how often, if you've been sexually active at least once in your life, please go out there and get tested. This is the only cancer that has pre-cancer cells, meaning that you can detect it early, you can get checked, and you can be treated, right? So go get your checks. It's called a pap smear. And if it comes out, clear, then you can get your vaccine. First shot, second shot 1 month after, and the third shot 6 months after. I would like to encourage you to do that. And men, please encourage your women as well, seeing that men are the carriers of the virus that causes cervical cancer.
Human papillomavirus.
Human papillomavirus, yes. The woman can't by herself have it. She has to come in contact with the man, meaning the man is the carrier.
That's why, it's always good to know, and live a life that, where heaven is the goal.
Yes, heaven will always be the goal.
Absolutely.
And stay faithful, men.
No sex before marriage.
Very important.
That's the way I've lived my life for the longest, and I plan to keep it that way. So I encourage more young men in our society to do the same.
Still talking about the importance of having conversations about prevention of cervical cancer, we're joined by Dr. Faisal Shuaib, who is the Executive Director and the Chief Executive Officer of the National Primary Healthcare Development Agency, NPHCDA, joining us from Abuja, Nigeria. Good morning, and thank you for joining us, sir. I would like you to please unmute your device. We're struggling to hear you a bit. And whilst that's happening, we've had a conversation this morning about cervical cancer, the importance of cervical cancer, and unfortunately, the lack of awareness across the country. So we'd like you to give us an insight into where we are and what the government needs to do to ensure that not only do we have awareness about this spread across the country, but a number of women who have been tested and have also gotten the HPV vaccination.
Right. So it's a serious disease in Nigeria, as you may be aware. Up to 73,000 women die from different kinds of cancers, but out of those, 12,000 of them will die from cervical cancer. In October, by October 23rd of this year, the government of Nigeria will be launching the HPV vaccine rollout, which will be an opportunity for women, girls, so to speak, will have the opportunity of accessing the vaccine, girls between the ages of 9 to 14 years in Nigeria. So we've already gone to town in terms of sharing public service announcements. At the subnational level, we have jingles already being aired in radio stations, in television stations. But beyond that, we've also gone to the communities, engaging with traditional and religious leaders, because these are the people who are the custodians of our traditions and are well respected in the community. So once these individuals are convinced, on the need for this vaccine, they take the message. It's now left to them to communicate. But because Nigerians as a people respect and honor the traditional religious leaders, and of course also their opinion and political leaders. We are still pushing ahead with creating awareness that this vaccine is a vaccine that practically prevents this cancer. There are only two vaccines that prevent cancer, where there's a direct relationship between taking the vaccine and preventing the development of a cancer. Already in the routine immunization schedule, we have the hepatitis vaccine that prevents people from getting liver cancer, later in life. And now we're going to be introducing the human papillomavirus vaccine that will prevent girls, our daughters, our sisters, our mothers from developing cancer later in life.
All right, it's very important to have this conversation, but we'd like to also ask you about the safety. There have been concerns that have been raised about the safety of these vaccines. We want to know exactly which vaccine is it exactly. Is it, can you confirm if it's Gardasil HPV vaccine? Because we have reports here that there have been some class actions in the US about the safety of this vaccine. I'm going to read, they said there has been over 100 class action lawsuits by parents in the USA alone who claim that it causes infertility and parents should be allowed to have a choice on the vaccination plan. So can you let us know if it's the same vaccine, if this, if this is something we should be worried about, and if you can confirm these claims or not?
Gardasil is the vaccine that has been tested. It is known to be safe. It is potent. There are, many, confirmed clinical trials that show the safety level of this vaccine. It has been approved by the FDA in the US, and our own NAFDAC as well has approved this vaccine to be safe. If this vaccine were not safe, you know that NAFDAC is an organization that has integrity. The federal government will not introduce a vaccine that is not safe. Of course, just like we had during COVID-19, you have all kinds of individuals, especially in the United States, that tend to politicize vaccines, right? The Republicans, for the most part, were not in favor of the vaccines. There were conspiracy theories, around the vaccination as a whole. So it's not about, HPV as it were. It's that there are some people who have conspiracy theories around vaccines, but we do know that vaccines work. Vaccines are the most effective public health intervention that we've ever had to all of humanity. And we are sure that this vaccine is safe. Again, if we look back to the days of the vaccine resistance in the US, again, it's a free society. People are allowed to raise their concerns, even if those concerns are not based or backed up by scientific evidence. You should allow people to speak. It is our responsibility as the scientists, the media, to make sure that people get the correct information about vaccines and vaccinations. If people do not know the right things, if they don't have the right knowledge, of course they will develop, all kinds of conspiracies, and then that is where information and misinformation is fueled. What happened during polio eradication in Nigeria in the 2000s. People said, it will cause infertility, right? But when we went back and gave correct information through our traditional and religious leaders, what we found out is that people now began to accept the vaccine and see how we've been able to eradicate white polio viruses, and all the girls
Dr. Shuaib,
took the vaccine, have gone ahead to have babies. So definitely no link between.
All right, Dr. Shuaib, but I'm certain that you understand, the concerns and the fears that Nigerians have. Not a lot of Nigerians trust, because you're mentioning NAFDAC now. Not a lot of Nigerians trust, the 2023 edition of NAFDAC to be able to certify, the safety of these vaccines. And I'm sure you would understand, where those concerns are coming from. But I agree that there would be further campaigns There would be further, outreach, done by your body and, of course, by NAFDAC and every other person involved to ensure that we get the right information on these vaccines. And, of course, set new targets with ending HPV, ending cervical cancer, or reducing it to its barest here in Nigeria. We unfortunately have run out of time for this conversation. We would like to speak with you again as your campaign continues, maybe in a few weeks, to continue with of course, the status updates. Thank you very much for your time this morning.
Thank you very much for having me.
Absolutely.